Hey everyone, how are you doing? Today I'm going to re-record this video for the 300th time, and we're going to talk about reducing cost of all-on-4 treatments. Okay, for a lot of people, having all of your teeth replaced with implants is more than just a vanity thing, but unfortunately there's a massive number of people who cannot afford the 15 to 18,000 pounds which it typically costs to have this treatment, and that's per arch. If you need to do top and bottom, you can easily double that cost. So I'm getting YouTube comments all the time about how greedy us dentists in the UK are and how we should just reduce the cost of this treatment. Now the truth is, if the costs associated with this treatment were lower, I am sure there would be clinics in the UK who would be reducing the cost. For example, Dentaprime is one of these. There's loads of people in the comments who are saying how can they afford to do things so cheaply. So in this video I'm going to talk about 3 ways which I think the cost of all-on-4 treatment can be reduced, and it's up to you if these are acceptable ways or not. Let me know in the comments. I would love to hear your opinion. So I think the number 1 way of reducing the overall cost is to reduce the cost of the dentist. Okay, so the dentist has to get paid a certain amount and reduce the cost of the components. These are the 2 inherent biggest costs associated with all-on-4 treatment. You want to have a dentist who is experienced in this kind of treatment to deliver a high standard every single time, and you want to have good quality implant components so that anything that you put on top of the implants lasts. So we could reduce the cost of the dentist by having somebody who is less experienced, maybe they're learning, or maybe we can just choose the cheapest implant that we possibly can and tell people they've got all-on-4, which really, okay, technically yes, but the components are not that great. And as a patient, you would never know the difference. If you've been following this channel for a little while, you probably get the feeling that I don't like this kind of method. The truth is, I absolutely love what I do, and if I could do it without being paid, if I didn't have any expenses, then yeah, I would probably carry on doing it as a hobby. But because I do love what I do, I want to do it to a really, really high standard. I want every single person who has an all-on-4 to have the best quality components, to have the best set of teeth possible. And this stuff does come at a price, okay, because I don't use cheap labs, I don't use cheap components, because once an implant is in, that is it, okay? I want that implant to be in there forever. It doesn't always work out that way, but that's our goal, that's what we want. So I choose the specific implants which are the best for the job, not based on the cost of those components. When it comes to the material of the teeth, there is more flexibility. The reason is, if we went for a kind of a softer material, something which isn't quite as strong, that can be changed later and it's relatively straightforward. There's no injections, it's just a case of rebuilding what is going on top of the implants. So I will definitely agree to have lesser quality components there rather than at the implant level. So this neatly brings me on to my second way of reducing the cost, and that is in the prosthetics. Okay, so in the actual teeth, like I've mentioned. Now, I do get patients who come and see me, even though we explain all the costs on the website, and when it comes to actually having the treatment, the budget is still an issue. Now, in these situations, I know that having a zirconia bar on the implants is probably the strongest and the best in terms of health against the gums. It's the best material to have up against your gums to cause the minimum amount of inflammation. But it is the most expensive. So what I've said to some people is, okay, look, how about we just get to the temporary stage? Because you have to realize when you're in a situation where everything needs to go, anything you get in that situation is going to be an upgrade. And even if we choose to have what we call a PMMA bridge, okay, which is like a hard impact plastic, if we have that kind of bridge made, it will look great. yes, it could potentially fracture. We could get a little bit of inflammation around the gums from there, but I think that's a decent trade-off in terms of cost. And also, if this bridge does break, it's relatively straightforward to remake it. I would actually charge a cost if we're just sticking to the temporaries, just to have really good quality temporaries remade. But it is possible at a much reduced cost, and a lot of my patients are kind of going down this avenue a little bit. Now, the important thing here is to have a long-term plan, because about 50% of the people who come and see me who want to have all-on-4 treatment, they do not need all-on-4 treatment. Their teeth are not bad enough, in my opinion. We can save their teeth. And what's really confusing is quite a lot of these patients have been to clinic to clinic to clinic to clinic, and typically when they go to these really low-cost clinics, they're being told that, yes, you need to have all of your teeth out, when in reality, that's not the case. There's a whole bunch of teeth that we can still keep. We're not going to compromise the aesthetics. It's not really going to change the cost very much. But in my opinion, that would be a better route to go. For example, I had a guy come in to see me, and he was in his mid-50s, I would say, and he had 1/3 bone loss around his lower teeth. And the dental clinic told him, you have to have these teeth out, they're all infected. They weren't infected. The gums were actually really healthy. And in, say, he got those lower teeth age 10, so in about 45 years, he's lost 1/3 of the bone that was supporting his teeth. That means he's potentially got 90 more years of life in his teeth before he loses all the bone. Okay, it just doesn't make sense what some clinics are suggesting. And typically it always seems to be those clinics who are offering all-on-4. They're exclusive to doing all-on-4 because their incentive is to provide all-on-4 for their patients. If all you've got is a hammer, then everyone becomes a nail. The third way to reduce the cost of your all-on-4 treatment is something that really became apparent to me recently when I was on a course in Brazil. And it was a course to do, say, zygomatic implants, which I'll do other videos about. But all the patients who were on this course were patients who would never be able to afford having a full mouth rehabilitation, okay, with dental implants. And a lot of them had no teeth, or they just had very few teeth. So it was an appropriate treatment for these people. And I think this is really cool. Okay, they didn't get it for free, but they got it at a dramatically reduced cost because they were part of a teaching program. Now, I don't have any teaching programs yet. Maybe I will do in the future. I'm currently in the process of setting up my own practice. We've got loads of space, so I think in the next couple of years I'll probably set up a teaching program. But there are places in the UK who do have these teaching programs. I can't think of any off the top of my head, but I'm sure if you just Google a couple of places, you'll find something out. Now, don't just go for any old place. Do some research on the clinicians who are doing the treatment. Make sure they are experienced and they can achieve what you're looking to achieve. Ask the same questions as if you were having all-on-4 at the normal cost. Okay, what is the final set of teeth you're going to get? Ask everything about the procedure, how they're going to make you feel comfortable, all this kind of stuff. You know, whatever is important to you, make sure you ask it. Just because you're getting a discount shouldn't mean that you're getting a reduced quality of treatment. Yes, the clinicians may not spend as much time with you talking about everything, but the treatment itself should still be to the highest standard. Now, I'm going to put a fourth way that we can reduce costs, okay? And this is really specific to almost right now, okay? So I mentioned that I'm in the process of setting up a dental practice. And if you want to know why dentistry is so expensive in the UK, start looking at setting up a dental practice. So far, I've had to put in about £200,000 of, and that's not including the cost of the building, just to set up a single surgery practice. Everything in dentistry is super expensive. Now, I didn't put all of this money down. I'm going to need to finance some of it over a long period of time, but financing something is expensive. Just like we buy our houses on a mortgage, your mortgage might say you're on 5 or 6%, but if you actually look at the overall amount of interest you're paying, it's more than the cost of the house. And the same is true for financing. I just got off the phone from a finance company, and they said if I want to borrow £40,000 for over 5 years, I'll actually end up paying about £53,000. And that's fine. I can, I'm pre-approved for that. I can get that money tomorrow. But I thought of a really cool way. If anybody is thinking about having all-on-4 treatment or significant treatment, what I've done is actually offer them a discount if they kind of pay upfront. Okay, now there's loads of things that we need to discuss before we go down this route, but essentially, instead of paying a higher cost on interest, I'm still paying the same amount because I'm reducing the amount of profit per case, but more people who actually want this treatment can benefit and get it at a slightly reduced cost. So those are our 3 ways of reducing the cost. Now remember, all-on-4 is not the only treatment out there. Here's a lady who had mini implants with dentures. Her smile transformation is amazing. Her smile looks so beautiful. The actual treatment you have can be made to look amazing. Okay, these teeth, it's difficult to tell. We've got 2 mini implants at the top, right? This solution, I believe, costs in the region of £5,000 compared to, your 15 to 18 on all-on-4, and it is life-changing. If in the future you wanted to change to a normal all-on-4, in a lot of cases it's still possible to do that. So if you're in a situation where everything is really, really bad and you need to do something, don't feel like you have to go for the absolute best solution. Definitely go for quality, but maybe consider these other options which are available. So as always, thank you for watching. I hope you got something out of it. If you did, give the video a thumbs up. It helps YouTube, or it helps me on YouTube. So until next time, guys, take care.